The first bill today is House File 1058, Representative Halverson. Hello. And Representative Halverson is going to move that House File 1058 be laid over for possible inclusion in the division bill.
Thank you, Chair. That is my motion.
Okay. So Representative Halverson and your testifier, welcome to the committee, and just go ahead and make your presentation.
Thank you, Madam Chair and members of the committee. Today you're going to hear two bills that strive to invest more resources in reducing the #1 cause of preventable death in the state of Minnesota, and that is tobacco use. Representative Mann's bill you'll hear next proposes to invest general fund dollars now to help current smokers quit. My bill is a little different. My bill seeks to address the problem with delinquent payments that the state is owed from cigarette companies and what the state should do with these delinquent payments if and when we receive those dollars. I first want to give you some background to put the bill into context. We have worked for a long time as a state to reduce rates of smoking in Minnesota and to make sure that people who do smoke and do have a tobacco addiction can get the resources that they need in order to quit. Proven, FDA-approved resources. As recently as 2014, Minnesota saw the lowest number of Minnesota high schoolers using tobacco products that we've ever seen, but we're losing ground rapidly. Just 3 years later, the Youth Tobacco Survey found that tobacco use had risen for the first time in nearly 20 years in our state. As an example, Minnesota high schoolers now use e-cigarettes on a regular basis. Nearly 40% have tried them. Think about that number of kids that represents in your districts or in your communities or in your own household. And meanwhile, smoking by adults is also taking a hit. We had been trending downward in tobacco use among adults for years, and we were far ahead of the national average of tobacco use. And now our progress has stalled. In addition, more e-cigarette users are people with no prior history of smoking. In 2018, 44% of e-cigarette users reported never smoking cigarettes, compared to 11.7% in 2014. And now nearly all young adults, that's 96.7%, report their usual e-cigarette is flavored. The reason is simple. The tobacco industry is relentless at targeting kids and keeping existing customers hooked. We know this because of the historic investment that Minnesota made with regard to the lawsuit against the tobacco companies many years ago. They had to open up their books. They had to open up their marketing tactics, and we saw firsthand that they are actively targeting kids, that they've been actively trying to get new customers hooked, and those new customers are people under the age of 18. So states and the country took action. We passed laws to change the way that cigarette marketing can be targeted. We changed regulation around how tobacco products are regulated. Enter e-cigarettes. Now we have a new product that is not subject to those same regulations, and they have exploited those loopholes dramatically. Juul is one of the most popular products on the market, and it's easy to conceal, and it's easy for kids and others to carry around with them. It also has an incredibly high content of nicotine. One Juul cartridge can contain as much nicotine as 1 pack of cigarettes. The other thing to consider about e-cigarette products is that they are not safe and they are not a quit smoking device. And that is really important for us to know because people are going to want to tell you that it's safe, it's a better alternative. Let me tell you that cigarette companies have used that line for years. Remember light cigarettes? Not allowed to market those anymore, because it was an evasive tactic by the big tobacco companies. Remember when doctors preferred Camels? No, you're not allowed to do that anymore. And so trying to equate any type of tobacco use with healthy behavior is just simply wrong. We know that e-cigarette products are another tool to get people addicted to nicotine, and these are powerhouse nicotine products. That's why I'm encouraging our state to take action against tobacco companies that have not been paying their fair share. We had a settlement that was required to pay into perpetuity from the cigarette companies that have cost our state billions. That is a proven fact. We spend billions of dollars on healthcare costs every year because of the tobacco use of tobacco. And the CDC recommends that the state of Minnesota spend $53 million annually on cessation. And that is a drop in the bucket compared with what the tobacco companies spend marketing to people in our communities, especially children, especially communities of color, especially the LGBT community. Meanwhile, since 2015, tobacco companies that sell several popular brands, including Kool, Salem, and Winston, haven't paid Minnesota a dime. My bill states that if Minnesota is successful in recouping these fees from these tobacco companies, approximately $12 million a year would be used to fund ongoing tobacco control in our state. It's not enough. It's a drop in the bucket compared to what we face, but it's a start. Through the tobacco settlement, our state earned a historic victory against big tobacco. Every year that cigarette companies fail to pay the settlement is a broken promise to our kids, to the taxpayers of the state, and to those struggling with tobacco addiction. Tobacco control programs save money and lives, and it only makes sense to use the settlement dollars for this purpose. I urge the committee to support this legislation and dedicate new tobacco settlement fees to tobacco prevention. This upholds our promise to youth. With more context and background, I would like to introduce Molly Moylanen from Clearway, Minnesota.
Right. Thank you, Representative Halverson, and welcome to the committee.
Thank you, Madam Chair. Good afternoon. My name is Molly Moylanen, and I represent Minnesotans for a Smoke-Free Generation. We're a coalition of over 60 organizations working to save our youth from a lifetime of addiction
And
to
Ms.
tobacco.
Moylanen, if you could just pull the mic up a little bit.
Oh, absolutely. It's kind of
Great difference. Thank
that
you.
better? So today is our annual day at the Capitol, and we have over 300 young people from every corner of the state here to ask their lawmakers to hashtag keep lungs loud. Specifically, we're asking legislators to increase the tobacco age to 21, include e-cigarettes in the Clean Indoor Air Act, and invest in cessation and prevention. And that's where House File 1058 and House File 350 come in. I also work for Clearway, Minnesota, the nonprofit organization funded with 3% of the original tobacco settlement awarded to Minnesota in 1998. Since 2001, Clearway has helped smokers quit, we've funded innovative research, and we've led advocacy campaigns. But Clearway was created as a life-limited organization, and we will end by 2022. We are already in the process of closing down our programs, closing down our grants, and downsizing our staff. Representative Mann's bill, up next, will focus on funding cessation services because our biggest program, Quit Plan Services, will end next year. Now, as many of you might remember, the original settlement also dedicated money to health through a number of endowments, but those funds were quickly repurposed to fund budget deficits. So since then, Clearway has funded the majority of tobacco prevention and cessation activities in our state. And there's a handout in your packet that illustrates these declining investments. This bill is an opportunity for the state to pick up when Clearway leaves off. This new revenue source should help fulfill the promise of the settlement for our state's smokers and for those young people who can still be saved from the pain of addiction. New research has quantified the impact of our collective efforts. Last fall, Health Partners Institute conducted a modeling study that found that over the past 20 years, prevention and cessation work has prevented over 4,500 cancers in Minnesota, tens of thousands fewer of hospitalizations for respiratory, cardiovascular disease, and diabetes, and saved $5.1 billion. That's over $900 per Minnesotan in medical expenses and work productivity. Now, and we've also prevented over 4,000 smoking attributable deaths. And because the benefits of our efforts grow over time, these numbers will continue to increase as non-smokers, ex-smokers, and never smokers live longer, healthier, and more productive lives in the future. The tobacco settlement was reached in part to compensate the state for the tremendous harms of tobacco use. These cigarette companies have shirked this responsibility, and if that wrong is righted, surely the best way to use this money is to help undo the damage they have done and help prevent the next generation of tobacco addiction. Thank you.
Thank you, Ms. Moylan, and I appreciate it. So there is we have a couple of questions, but there is also an amendment in the packet, and I wonder, is that yours, Representative Halverson? And do you want to move that and explain it, and we'll move that one before we take questions on the bill?
Thank you, Madam Chair, and yes, my apologies for jumping the gun. I would like to move the A1 amendment. It is a technical amendment that just clarifies language within the bill, and it would get the bill in the shape that I would like to pass it.
All right, thank you, Representative Halverson. Is there any discussion to the amendment? Does everyone have it? It's the A1. It should be in your packets. All right, seeing no discussion, all in favor of the A1 amendment, please say aye. Aye. All opposed, no. The motion prevails and the amendment is adopted. Okay, we have some questions from members. Representative Munson.
Thank you, Madam Chair and Representative Halverson. This is a great bill. Thank you for bringing it forward. I think we should be doing more to address the youth smoking, and this definitely will help with that. One of the concerns I have is that you have a co-author on the bill, Representative Freiberg, who's also authoring House File 420, which legalizes marijuana in Minnesota and allows for the development of like gummy bears and lollipops and stuff to have extremely high concentrations of THC, much like what you discussed with the Juul cartridges for vaping that have high concentrations of nicotine. Can the money that you're using in this program that you're asking for be used for the cessation of all kind of smoke-related products like the e-cigarettes you mentioned, also for marijuana and for these derivatives of marijuanas like gummy bears and lollipops that are being catered towards children, and the dabbing that we hear about is also kind of a trend where the kids in Colorado where it's legal are using the super highly concentrated THC. Would the money from the tobacco settlements be able to be used for prevention for marijuana products?
I suppose the question would probably include and methamphetamines and opioids and anything else that might be a substance that a person could become dependent on. Representative Halverson.
Thank you, Madam Chair. The dollars go directly to the tobacco prevention account, and that is there will be a special revenue account that MMB will create, and its designation in the bill is that the Commissioner of Health is to dedicate that money for use for prevention activities surrounding tobacco use. So we're asking the manufacturers to pay for tobacco use in the state of Minnesota. And that is part of the settlement that we are part of. They're just violating the settlement, and that's why we're trying to figure out what to do with this money when we get it.
All right,
And
thank
follow
you.
up, Madam Chair.
Representative Munson.
Representative Halverson, it spoke about the vaping in e-cigarettes, but that isn't tobacco, and that isn't from the tobacco companies doing. So you're using their settlement money to prevent another product that's not created by tobacco companies. Why not marijuana that's being introduced this year?
Madam Chair and
Halverson.
Representative, this actually, e-cigarettes are actually defined as a tobacco product under our state law, and we tax it like tobacco and we regulate it like tobacco. The only thing we haven't done is regulate the clean indoor air standard in bars and restaurants, but that bill is coming.
And
Okay.
Madam Chair, I just wanted clarification because the House File 420, which is one of your co-authors on this bill, is introducing that a legalized marijuana would also regulate and tax it just like tobacco. So I just wanted to see clarity, would this money be able to be used to prevent marijuana use?
I think we got the answer to that. Thank you. Representative Acom.
Thank you, Madam Chair, and thank you, Representative Halverson, for bringing this forward, and Ms. Moylan for being here today. As a former smoker myself, I certainly understand and recognize the tie that tobacco has on people, and so I appreciate the efforts that we can implement to to break that. And so I have a question. You're talking about the tobacco settlement violations for a few different brands of cigarettes, Kools, Salem's, and Winston. So if they're not paying what they're supposed to be paying, can we prevent them from being sold in our state?
Interesting question. I will
Yeah, Representative
defer to
Halverson.
Ms. Moylanen if she has an idea. It's
Ms.
an
Moylanen.
intriguing, you raise an intriguing question,
Just a
Representative.
thought.
Ms. Moylanen, you want to tackle that?
Madam Chair and Representative Acom, thank you. You could look into that and you could pursue that. This bill does not go that far. This is a dispute that's currently under litigation between a few tobacco companies themselves, and the AG is taking action on that. But in terms of how you would, I think once that dispute is settled, then you could decide how to move forward with that. But it's under current litigation, so maybe not at the moment, but it's a good idea. We'll talk.
Okay, thank you.
It is a good idea.
All right, so Representative Zerwas.
Thank you, Madam Chair, and my apologies that I came in late to your presentation, Representative Halverson. As I read the bill, it takes all of the money from the tobacco settlement payments each year into a special fund and then appropriates $12 million out for cessation efforts annually. Last year, I think we took in close to 160 million in funds. So I'm just wondering, it won't take long before this gets to be a pretty large amount of money, and I'm just trying to figure out if I'm understanding the bill correctly, and if so, what happens as that amount begins to grow.
Madam
Representative
Chair
Halverson.
and Representative Zerwas, I can improve your understanding of the bill a bit. It's not all of the tobacco settlement proceeds. Unfortunately, those proceeds had been used to settle budget issues for the state of Minnesota many years ago. This is for the delinquent proceeds, those that have been building up that these particular companies who are in having a dispute about who pays what have not paid to the state of Minnesota. So it takes a portion of that.
Yeah, Representative Zerwas.
Madam Chair, I guess to the author, do we know what was that amount in 19? What was that amount in 18? Can you give us some of that information?
And just Representative Zerwas, I was going to, and I don't know if you could please, you can go ahead and answer, but I was going to ask Mr. Berg to give us a little background as well.
Whomever, yeah.
And your question's really apropos because I was, we were kind of talking about whether he could do that because there is sort of a common misconception about where this money is going and so on. Mr. Berg, could you give us that little quick
Madam Chair, members, I frequently get this question related to how much of the tobacco settlement proceeds the state currently dedicates to tobacco cessation, and the answer is none. Now, the issue, the state gets a annual payment, which is unrestricted revenue to the general fund. Currently is, I think, about $160 million. It's a declining revenue source. By the end of the forecast period, 23, I think it gets down to around $140 million. That's missing the revenue from the companies that Representative Halverson's bill is looking at. I have heard that that's estimated at 12 to 15 million a year, but I don't have any way to back that up. And and that's as far as I can go. What we spend on tobacco cessation is as it was pointed out on this chart that that was passed out, there's some SHIP funding and there's some tobacco-free communities grants. But Clearway is separate from the state budget and was provided for in the legal settlement, and their money does not flow through the state budget. No other money the state gets from the settlement is dedicated to smoking cessation.
And Mr. Berg, has it been that way ever since the settlement was reached?
Madam Chair, I'm not sure of the answer to that. There used to be we used to have the tobacco endowments, they were called. There were 3 tobacco endowments, one of which I think did spend some money on there was one related to health and the university got money. I think some of that went to tobacco cessation, but the state cashed those endowments in years ago.
Okay. Representative Zerwas, did you want to follow up on that?
Well, I think that's very helpful, and I appreciate the additional information. If we're looking for money from arrears to fund this, what happens if the money doesn't come? And what if they don't? What if they continue to not pay?
Well, and go ahead, Representative Halverson.
Thank you, Madam Chair and Representative Zerwas. Our number one hope is that they pay and that our Attorney General can get the settlement. If they don't, this is an if situation. It's an if-then. So that is what the language of the bill does. If that money comes in, we're going to spend it to make sure that we can help people quit smoking.
Right, and thank you. And I would just add to that, Representative Zerwas, we always have our state budget that we have to make determinations and set priorities about what we ought to be funding. And I think we probably all agree on this committee that, funding to prevent people from getting hooked on nicotine is money well spent, and that whatever treatment we can do is also money well spent with regard to the health of our citizens and our long-term HHS budget as well. Other questions from members or comments from members? Okay, very good. And could I just ask the people in the room, how many of you are here for, what's the name of your day, Tobacco Cessation Day, or?
Minnesotans for a Smoke-Free Generation.
Oh, Smoke-Free Generation. How many of you are here with that group? Oh, that's fantastic. Wonderful. Welcome. Thank you for your advocacy. And so if there's no more discussion on this bill, then House File, Representative Halverson renews her motion that House File 1058 be, as amended, be laid over for possible inclusion in our division bill. So that will be done. Thank you, Representative
Thank you, Madam
Halverson.
Chair
Thank
and
you,
members.
Ms.
And I would, if I may, Ms. Moylan brought a visual aid that I would love to pass around as we hear Representative Mansville. When I talk about using cartoon characters and the way they market to kids, this is a product. It's an e-cigarette juice product called Unicorn Drops. Use your imagination, what they're trying to get at there. But take a look at this packaging and tell me what your kid would do if they saw this.